Hello everyone, my name is Dr. Hamadadar and you are watching sqadia.com, and today our lecture topic would be crystalline deposition disorders. Have you ever wondered or have you ever seen even patients with disfigured hands and joints, how debilitating this can be? Well, today our topics are actually related to those diseases which mainly affect most of the joints of the body, and usually patients present with swollen joints and a lot of swollen areas around the joint. Well, today our topics would include gout, which is one of the very most important topics of crystalline deposition disorders. Then we will be covering the management of the gout, which is itself a huge topic, although I will try to cover it as quickly as possible. Then the third topic is calcium pyrophosphate crystal associated arthropathy. Now we have a plethora of literature available about calcium deficiency, and people usually hear about a lot of news about vitamin D deficiency and loss of calcium, low calcium in body and all that. But have you ever wondered what happens when the calcium phosphates actually increases in our body? Well, there are certain calcium metabolism problems which are associated with increase of calcium. For example, there is calcium pyrophosphate deficiency, calcium pyrophosphate deposition. Then you have basic calcium phosphate crystal deposition. And lastly, we will be going through the psoriatic arthritis. We will be going through its general characteristics, pathology, and clinical features, its investigation and treatment. Thank you very much.